You've tuned in to Unpause Your Life with Dr. Callie Estes and Dr. Tara Lynn Sell. Your access to success strategies and more to help you move onward and upward with your life. Listen in each week as they interview others who have really taken their essence to the next level and truly unpaused their life. Now here are your hosts, Dr. Callie Estes and Dr. Tara Lynn Sell.
Hey everyone, welcome to the show. This is Dr. Callie Estes, and I am founder of the Addictions Academy, the Addictions Coach, and Rehab Rescue. Welcome to Unpause Your Life. This is a great podcast where we showcase people who have done something extraordinary with their life. I welcome you, and I hope you enjoy all of our guests.
On my way, found a reason to wake up another day. But they needed to
You are listening to Unpause Your Life with Dr. Callie Estes of the Addictions Coach and the Addictions Academy, and my lovely co-host,
Dr. Tara Lynn from drtaralynn.com.
Our guest today is from Texas, so we're going to talk about the Cowboys, despite Dr. Tara's trepidation for them. Dr. Pari Ghodsi, an OBGYN and women's health expert. She is renowned expert in women's health and board certified and active fellow of the American College of Gynecology. She graduated summa cum laude with a BA in psychology from Southern Methodist University in 2002. She went to Baylor College of Medicine in Houston, Texas, and she completed her residency in gynecology at George Washington University in Washington in 2010. She then practiced in Plano, Texas. Go Cowboys. Told you I'd work that in there.
Go Pack. Go Pack.
And she's been named a top doctor of Collin County by D Magazine. That's huge for those of you in Dallas. Welcome, Dr. Pari.
Thank you. And now I've left Plano. Updated is I moved from Texas to LA about 2 years ago, and here I'm an OBGYN hospitalist, which I can explain what that is, but I work out here in LA in the Valley at Northridge Hospital. So.
Okay.
I got to ask you, my very first question is, why did you choose gynecology?
So, it's interesting because I always knew I wanted to be a doctor, but I didn't know what specialty I wanted to go into. I used to think I wanted to do some sort of pediatric subspecialty because that's what my uncle is, and he's a pediatric neurologist, and he was part of my inspiration to being a doctor. But when you go to medical school, you notice a divide. I think people either kind of fall into more medicine-based or more kind of procedural-based. And I could tell that I was somebody who was more procedural-based, like I wanted to do something with my hands. And then I wanted to work with women because I'm just always an advocate for women. I'm a girl's girl. I've been a bridesmaid like 15 times by now, and
there's movies about that.
I know. I've watched them. My mom's watched them. My dad's watched them. But yeah, so I just always wanted to work with women. And then honestly, I did my OBGYN rotation. I delivered a baby, and I knew. I was like, this is it.
You were hooked. You were hooked from there.
Exactly.
So from reading your bio, you're pretty young to be so accomplished already. What words of wisdom do you have for people that are trying to succeed at a young age?
I really thank my parents for that. They always pushed me and always taught me persistence. I always wanted to be a physician, but it's not like I was the smartest person that I've ever met. I think hard work and dedication and really persistence. For instance, I took the MCAT twice. The first time I took it, which is, the entrance test to get into medical school, I took it and my score was good enough to get into med school, but not as good as I wanted it to be, not where I wanted to go. And I remember even my college counselor at the time was like, just keep it, you'll get in. And I was like, well, but I really want to go to some better schools. And my mom was like, no, you can do better. If you want to do better, you can do better. Study harder, try harder. And that was kind of always the mentality that my parents had. I took it again. I did do better. I got in where I wanted to go. And so I think I've always been just taught that hard work and perseverance pays off.
Mm-hmm. So you primarily, or you said you have a penchant for working with the millennial population?
Yes, for sure.
And why is that?
I mean, I'm on the cusp of millennial, I guess.
Yeah.
I'm right there. I was born in 1981, so it's still technically my generation, but I also feel like I relate well to the younger side of the millennial generation. I think it's a unique generation. I think it has unique problems. And in terms of reproductive health, you're seeing unique problems that you didn't see in other generations. For instance, this is the first generation that is delaying childbirth, that is freezing eggs, that is kind of having these different considerations that we had, that our mothers had. There's obviously also a difference in the dating culture, sexual health. And so all of that I can relate to and really like to educate women about their health.
Mm-hmm. I always wonder about why people choose the professions that they're in, and there's usually a story behind it. When I was thinking about this interview, I was thinking about what I see in my office with women and teenagers, and I see a lot of people using birth control to help manage things like depression and anxiety, especially in the teenage population. And I'm just really curious about that. Do you have any thoughts on why they would do that? Or is it a hormonal issue? Does it help? Does it hurt? What do you know?
So the only time that there's an actual benefit of being on birth control pills in terms of mental health is when you have something that is called PMDD, or premenstrual dysphoric disorder. This is like PMS gone crazy. Okay. And these people have a very specific symptoms about halfway through the month, around the time after you ovulate up until, your period, and through your period, they have intense depression, intense anxiety where it's debilitating. Those people, we know if you put on birth control pills, it will help the same way as, say, an antidepressant would, because they have a true hormonal imbalance that's leading to their symptoms. But if you are suffering from depression or anxiety throughout the month at different times, I don't necessarily think a birth control is going to make a difference. Again, it's tailored. You've got to kind of pick through where your symptoms are, but it's not first line treatment for depression or anxiety generalized.
Mm-hmm. I always felt bad for my husband because we had 3 women in the household at one time, all, having their cycles within a week of each other. And I always felt like it was a little bit torturous for him. But how do you know the difference between what is normal and what should be looked at as far as those symptoms go?
It's all about how it's affecting your life. So most people have some sort of premenstrual symptoms. They are fatigued. They might be irritable. They're a little bit more emotional. You want to eat a lot of chocolate and lay in your bed. That's normal. Where it's abnormal is where it starts interfering with your life, where you're so depressed or you're so anxious that you don't want to go to work. You don't want to go to school. You can't sleep. It's affecting your eating, where it's meeting true criteria for, if you weren't in this time of the month, that you'd be meeting criteria for real depression or real anxiety. Does that make sense?
Yeah, it does. And do you have any suggestions for people outside of birth control? What can they do?
So if you have true premenstrual dysphoric disorder, like we're talking about, birth control, but then also an antidepressant can also help. You can actually just also go on hormones in the latter part of the month as opposed to being on birth control every day, because it's from a drop in your progesterone after you ovulate. Everyone has a drop. Some people, for some reason, are just very sensitive to it, and those are the people that are getting the PMDD and the anxiety symptoms in that time period. So you can also talk to your doctor about just taking progesterone replacement those 2 weeks if you don't want to be on a birth control all the time. And then, of course, always with any sort of mental health illness, I recommend some sort of talk therapy.
Oh, I thought you said shock therapy. I'm like, what?
No.
Hold on a minute here.
Talk to somebody.
Okay, scared me for just a second. I also think reducing sugar tends to help a lot of cramping and things like that people struggle with. Yeah, so diet.
Yeah, for regular just PMS symptoms, all of that stuff as well, like the reducing your sugar, reducing caffeine, and reducing alcohol, all of those around that time of the month. Magnesium helps. as well as a calcium supplement.
Absolutely.
So those all help for PMS, and then getting into the right amount of sleep also.
That's something that's quite elusive for people. It's easy to say, but hard to do.
Exactly. But if you're suffering from bad PMS or cramps around that time of month, it's even more important to try to get rest.
Mm-hmm. I feel like all we're going to be doing is talking about a menstrual cycle, so I wonder how many male listeners we're going to lose today.
Hey, well, a lot of guys, it's funny because when I started these endeavors of speaking publicly about these issues, at first you think, oh yeah, my audience is just women. And then there's so many guys that are like, oh, I read one of your articles. I listened to something that really helped me because my sister or my girlfriend, like you said, like your husband had 3 women in the house. So it's interesting. It's sometimes, men actually listen because they can relate to it from somebody significant in their life.
Right. Every time there's a mood related issue, that's what it gets blamed on in my house.
So I'm going to shift a tad for you guys. I've got a client whose wife is pregnant and he's complaining. By the way, I have no frame of reference. Most of my clients are men. So this is kind of out of my wheelhouse. I'm a female. I get it, but it's not my thing. So I got a client whose wife is pregnant and he doesn't know what to do with the hormone rushes she's having. So how does one handle that if you're the spouse of somebody who's pregnant on her 3rd month and he's ready to throw her out the window?
Oh, patience. I mean, I think what he's doing, if he's already talking to you about it, that's really the best thing that he can do. And of course, if it's getting really bad, some sort of family therapy. I don't think there's a cure-all for a hormonal pregnant woman.
I'm sorry, I'm just chuckling over here because in my mind I went, just take a walk, run, get out of there.
I'm like,
go get her what she wants,
Yeah, totally. Patience,
ice
deep
cream,
breathing.
whatever. Yeah, exactly.
Yeah,
Take care of yourself.
massages. But it's definitely a stressful time. It's people in general, as you know, when they're married, when they're trying to get pregnant, while they're pregnant, and those first couple of years after they have the baby really can test a relationship.
Mm-hmm. I think men are more apt to want to fix it than help themselves through it,
But yeah,
Callie, is that what you think too?
Well, I mean, my clients come to me for addiction related issues. So drugs, alcohol, escorts, blah, 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 gambling. So, I don't really know what to tell him because I've never been pregnant. I don't have kids. I don't work with women. So I'm like, well, I don't know what to tell you there. I completely identify with you. So I was trying to come up with ways to release his stress because she is unbearable and it's pretty bad. So
it's a hard conversation because when you're hormonal and unbearable, like you don't want to hear somebody say you're unbearable. And I think it's your hormones.
Right. Dr.
It's the last thing
Tara,
you want to hear.
I'm unbearable all the time, and it's not because I'm like.
Well, and then there's
I can attest to that.
There's also the question of is what else is going on, and what was the relationship like before the pregnancy? It's like any sort of life stressor; it's going to test it. I don't know if we can just put the blame on the woman and say, "Oh, it's because she's pregnant and she's hormonal and she's crazy." I mean, there's likely something else going on between them. Those situations tend to be complicated in my experience.
Is there something she can do or a supplement she can take to help her feel better? Because she's obviously uncomfortable.
There's not really a supplement. And again, I don't know her. I don't know where her struggle is coming from. I don't know if it's she feels tired. I don't know if it's because she feels, heavy, body image issues, pain. She could have complications with her pregnancy, and the list can go on and on. So it's hard to say what someone can do unless you know exactly what they're struggling from. But with that said, if it's just kind of a general, I feel overwhelmed and I feel stressed, I think kind of what you had recommended for him about getting out and taking a walk and things like that, I think taking time for herself just to kind of break away, whether that be like a nice massage or a day with her girlfriends, something that's kind of me time to kind of get away maybe from the situation with her husband, and then just kind of remember who she is. A lot of times people just are so anxious about the pregnancy that they forget about themselves. So just maybe some self-care and social support. I think that's really helpful, is talking to other moms that have been going through similar experiences can help.
That's good advice.
Do you think some of that irritability can be what's called postpartum depression, but happening during pregnancy?
So it's all about definitions, right? So postpartum depression is its own entity, and it's not to be confused with what's going on in the pregnancy. With that said, I think you bring up a good point. Like, is she irritable or does she have depression? And that's something she has to figure out with her doctor, where she lies. And that's a really good point, because she could actually have something going on, like a major depressive disorder or anxiety, something more than just a regular, I'm a little bit more emotional. So that's something to definitely, she should talk to her doctor about if she's really having issues that are interfering with her life. Mm-hmm. And then to go towards postpartum stuff, that's a different issue. So typically once you have the baby, there's something that's normal, which is called postpartum blues, where people, not everybody, but a lot of people will experience a few days of kind of being tearful and anxious and just kind of unsure. A lot of times they worry about bonding with the baby, breastfeeding with the baby, those kind of things. That is still considered to be normal if it's, it lasts a couple of days to a couple of weeks. But when it goes beyond that, and it's something that's interfering with, again, your sleep, your eating, a lot of people get really apathetic, like they don't want to care for their baby. They have those types of feelings. Well, then that's when you're categorized as postpartum depression. And that can be up within the first year of after having a baby, which is important for people to know too, because a lot of people, they had a baby 6 months ago and they're feeling depressed and they're like, oh, it can't be postpartum depression. That's not true. If you have like these major depressive symptoms within that first year, it's still considered postpartum depression.
I actually had postpartum depression with both of my kids. The first one was completely unrecognized, but it was really scary because I could relate to those women that wanted to hurt their children, their babies. It was so scary, but I talk very openly about it in my practice because it's not something we talk about. Mom guilt all the time. Well, that plays a role in it. Like, you literally want to hurt your child because you're feeling so helpless and defeated, and just, it was a horrible time for me. So and that was 24 years ago when I was pregnant that time. And then, my son is 16. So when I was pregnant with him, they actually put me on an antidepressant because I started feeling the same way towards the tail end of that pregnancy. So I was on an antidepressant for a little bit after he was born. Which I don't know, I struggle with that too as a mom. Did I do the right thing? Didn't I? I have no idea. He seems fine.
If you need a therapy session,
he seems fine now.
If you need therapy, I have an hour open.
It sounds like to me that you
don't work with women.
I don't work with women.
It sounds like you did the right thing.
You could pay me to tell you did the wrong thing. I'll just tell you did the wrong thing, and then I'll send you a bill.
No. She just said I did the right thing for free, so I'll take her advice.
Of course you will.
I think you did the right thing. I mean, first of all, I'm sorry that you experienced that. It's really scary, and that's
very scary.
A very common story too, where first time goes unnoticed, then somehow they kind of clue into, wait a minute, I had that last time I was pregnant, and then luckily you're able to prepare for the next child a little bit better, but it sounds like you did the right thing. There's, everyone always asks about antidepressants and pregnancy or with breastfeeding. And, there's a risk and benefit to everything. But especially in a situation like yours where you were actually having thoughts of hurting your baby and things like that, the benefit of taking it is much greater than the risk of not.
So my mom guilt is kicking in over here, and I'm going, okay, my babies, I do love you. I'm having mom guilt around love right now. Yes, exactly. But it wasn't until I think there was some news stories about women that were hurting their babies that after I had my first child that I was like, oh my God, that's what that was. I really had no clue what it was. So for the second time around. And I talked to my daughter about it too. I'm like, this might happen to you.
Exactly. That's great.
Mm-hmm.
It's great that you told her that, because that's one of the things we always talk about is when you go in, even from the beginning for your first prenatal visit, you want to make sure that you're like disclosing everything in terms of any sort of your history, but also family history of mental illness, because it does play a role.
Mm-hmm. Mm-hmm. All right. Now I'm going to fast forward a little bit into, I'm asking for a friend. Any tips on menopause?
For a friend. Hold on a sec. For a friend.
I'm asking for my friend Callie. Is there any tips on menopause?
I'm not
she's really hard
menopause.
to be around.
I'm still 29.
Anything besides a ceiling fan in the bedroom?
Yeah, there's herbal stuff, and then obviously there's hormone replacement, right? And hormone replacement, again, that's something you're going to want to talk to your doctor about based on your symptoms, based on your medical history. It's not right for everybody. It's another one that has risks. So if you want to try to go a more natural route, something that is really helpful is black cohosh. Have you heard about black cohosh?
Yes, I have. Yep.
Are you taking it?
I think because it's for my friend.
Right.
I think my friend is taking it.
Your friend. Yeah. Is your friend taking it?
I believe my friend has taken it in the past, but didn't give it a fair shake.
Okay. Yeah. It's one of those that you're going to need to take, or your friend is going to need to take over time, and then see how they do. That's really the number one. There are some other ones that are out there, like, ginseng, evening primrose oil. Those are the more natural ones that people talk about, but black cohosh is the one that's the most proven to help.
Mm-hmm. All right. So I have a quick question off subject. And so we're trying to ask everybody these questions. So what's the most badass thing you've ever done in your life?
Oh my gosh. In my life? I mean, yeah. I think still some of the more scary type obstetric situations where, someone comes in and their baby's crashing and I have to do a C-section and get the baby out within a minute. Those kind of situations, although I don't want them, those are not the ones you ask for. They are afterward, you do feel like, wow, I just did something really cool and like saved
pretty amazing
someone's life. Yeah.
Exactly. That's pretty awesome. Yeah. You just did something pretty awesome. I have another question for you. So I'm sure you've seen a lot of things and heard a lot of things. So what is the worst advice you've ever heard of that someone has come in and said, hey, they told me to do this? What's the worst advice?
Worst advice overall in general, I think I have a real kind of passion of speaking out against any of these things where people are putting things in their vagina. Like
glitter included?
I'm sorry?
Glitter included?
Glitter included. Like glitter.
Vajazzling.
Have you heard about, all these weird things, vaginal steaming, all these weird things about putting things in your vagina. I am totally against. It doesn't make any sense. It's ridiculous. That's the worst advice.
We could have had a whole show on things that go in your vagina.
I've written articles about like 5 things to not put in your vagina, and that are common things that people are doing. It's crazy. It's really crazy.
People are putting common things in their vagina? What?
Well, I'm saying there's common advice to put certain things in your vagina.
All right, so I gotta know. What are those top things? What was in the article besides glitter?
There was the glitter. Number 1 was like vaginal steaming.
What is that?
Did you?
I don't even know
hear
what
about
that is.
So it became popular like a few years ago because actually Gwyneth Paltrow like wrote about it on her website, and she was going to some place in Santa Monica where she was getting vaginal steaming, and it's basically where they shoot steam into your vagina, and the idea is. It's ridiculous. The idea is to clean it out or something, which, okay, fine.
Isn't it self-cleaning, like a self-cleaning oven?
Self-cleaning, exactly. It's a self-cleaning entity. And then, but also it's hot, and the inside of your vagina is like the inside of your mouth. Like it's sensitive. It's a mucous membrane. So you could get burned. It's really a bad idea.
Are you talking about the steam is hot or your vagina is hot?
The steam is hot. No, the steam is hot. So putting that into your vagina could really actually burn you, you know?
Oh.
And then the other thing is, and the other thing about the vaginal steaming is that people are saying, oh, it helps with like fertility. I'm like, how? It doesn't make any sense. Your vagina is a dead end. So like there's your cervix, which has like doesn't make any sense. It's like your cervix that has like a pinpoint hole in it. But the idea that steam could go into that pinpoint, into your uterus, and then into your, like, out your fallopian tube, and to do what? It just does not make any physiological sense at all whatsoever.
Oh my gosh, I'm laughing so hard over here. This is hilarious.
So
that's another one.
Things not to stick in your vagina.
Yeah, don't put that in your vagina. And then the other thing is tea tree oil. Have you heard about this?
Yes, it burns.
That's another.
It burns.
Exactly.
Don't ask me how I do that.
Burn. I don't understand where it came from though. Like I don't know.
Callie, how do you know that?
Okay, so I'm big on the oil in my bath. So I'll put eucalyptus in a bath and get in. Yeah. Well, I put tea tree and I sat on it and it wasn't very comfortable. That's the last time I ever did that.
Do you have to put milk on it to, like if you eat something spicy, like putting
something
milk?
basic. Yeah.
Now we're sticking whipped cream in our vagina. This is nice.
Was that in your top list? Whipped cream?
Which one?
Vagina. In the things to not put in your vagina, whipped cream.
Yeah, so anything real sugary, that's another thing, is like sugary lubricant, like even like that, like your diet. I'm like, this is like a daily topic for me now, so I'm like so immune to it. But like but anything sugary, like sugar, lubricant, chocolate sauce, anything like that can just totally change the pH balance of your vagina, and then that'll lead to like yeast infections and bacterial vaginosis.
Ew.
So no chocolate pudding.
No.
This is my.
Are you going to list that on the list, Callie?
Yeah. No,
are you putting together the food list for Tim?
If you want to like lick that off of someone's arm or something, that's cool, but don't put it in your vagina.
Do not put food in your. I needed this conversation 20 years ago, my dear. Because 20 years ago.
So put food in there.
We needed to start the podcast with this conversation.
I got to ask this question. How do you have a serious conversation with a woman that's like 50 years old that comes in and sticks pudding up there? How do you have a serious conversation?
Well, I mean, it's, you know how it is. You go in, you're in your mode. It's a straight face. It's a issue. It's a medical issue at that point. It's not really something, it's not jokes outside. And sometimes you can not have a straight face and be like, okay, what were you doing? You know, one thing that people do commonly is
seriously,
when they have
sugar-free pudding.
Huh? What?
I said, like, seriously, just use the sugar-free pudding. Is that what you said?
God.
Yeah. No, don't use any pudding. But, something else is, another common thing people do is when they have a yeast infection, they try to do holistic stuff. And one of the holistic things is put yogurt in there. Put yogurt in there. Yes. People do that.
There goes Dr. Tara's weekend plan.
Damn, I bought a bunch of yogurt.
I can't believe
and the idea behind it, I get, because basically yogurt contains lactobacillus. Lactobacillus is a known good probiotic for your vagina. And if you take lactobacillus, you help maintain the pH balance of your vagina, and that will reduce your risk of yeast infections. But that is by mouth. You want to eat yogurt regularly or take a lactobacillus pill regularly if you are having, frequent yeast infections to keep your pH balance. But it doesn't mean once you get a yeast infection to put, yogurt in there. It's something just gets mixed up in it's like that game of telephone when you were little, you know, it's like someone whispered something and someone whispered something, and then all of a sudden someone's putting yogurt in their vagina.
Oh my gosh. What playground was that on? I was on the wrong playground. I missed that one.
This is the adult one.
Oh my God.
Oh, that is so funny. So the moral of the story is food belongs in your mouth, not in your vagina hole.
Yes.
It's not that hard, people. It's not that difficult.
It's not.
Oh my gosh, that was hilarious. You know, the whole time it wasn't about her vagina hole, but my daughter used to shove things up her nose. Like she would pack her nose full of like meat and stuff. She's going to kill me if she hears this. Anyway, meat, yeah. Like taco meat.
Oh my God.
That's a whole other show for a whole other day.
But I'm thinking, I wonder if anybody's done that. You know?
So
I
just Googled things not to stick in your vagina, and there's actually an approved list of things that can go into your vagina on sheknows.com, and number one is a penis. Imagine that.
Oh, hey,
yeah. I was going to say, did my name pop up? Because I feel like I've written or contributed to this type of article like at least 20 times by now. It's what to put, what not to put.
Oh my
I suppose it's what's trending. What to put or not put in your vagina hole is trending.
Mm-hmm.
How do people not know this?
I think part of it too. They're doing telephone, but but I think also part of it is celebrity stuff. You know, in general, as you guys know, once a celebrity says something, then all of a sudden they're influencer and people are doing it. So, for instance, the Gwyneth Paltrow thing, that was vaginal steaming. And then at some point, Khloe Kardashian, I remember, was talking about putting vitamin E in her vagina and that she was doing that for strengthening it. And vitamin E is not something that's going to be harmful at all. It's just a lubricant and a moisturizer, but it's not necessary. It's not going to make your vagina so much stronger, you know, but I think that's part of it too, is just nowadays everyone is an expert. So you can go online, you can say something, and if you have enough people listening to you, it catches on.
Well, I mean, seriously, if there aren't any medical concerns, do we really need to like make our vaginas stronger as if we, you know, like do crunches or Kegels or whatever?
Yeah.
Is that, do we really need to do that? I mean, is that something that is absolutely a necessary thing to do?
I do promote doing that even throughout your life to strengthen those muscles for a few reasons. I think it does help with your sex life and for a woman to be able to have a fulfilling, I don't know how bold I can be on this show.
Be bold. We've already talked about vagina hole.
You could be as bold.
I know. Okay, I was going to say it does help if you can strengthen those muscles and kind of learn how to use them. I do feel like it can help you for women achieve orgasm. So that's important, especially if there's someone who has difficulty doing so. I think it also helps with maintaining those muscles when you carry a child, when you go through childbirth. There is something that you may know that later in life, some women experience something that's called prolapse, where they start to have kind of herniation of either their bladder, their uterus, or their bowel that kind of comes through the vagina after having children, multiple children, heavy children. If you do this, you definitely won't have this, or if you don't do this, you definitely will have this. But we do think that strengthening your pelvic floor, either through Kegels or even like Pilates, yoga, can help prevent having prolapse later in life.
You hear that, Dr. Tara? I do yoga, I do Pilates, and I strengthen the JJ. You know what that means? I'll be swinging through the rafters later.
With your pudding. And
with my
yoga.
Chocolate pudding and my glitter.
Yeah, exactly. Apparently I'm going to the yoga studio tonight, folks. Let's do this.
This has been absolutely fun, and we are so out of time. It's ridiculous. But I want to thank you for coming on and let our listeners know where to find you.
So if I have a website, it's drpari.com, DOCTORPARI.com. And from there, you can really just link to my Instagram, Facebook, Twitter, and that's how you find me.
Awesome. Well, again, thank you for coming on. And you're listening to Unpause Your Life with Dr. Kelly Estes and
Dr. Tara Linsell.
And one of us is going to be having good sex later. Have a good day, guys. Hey, everyone. Thanks again for listening. I really hope you enjoyed the show today. Head on over to iTunes and Apple Podcasts and leave a comment or review of what you think. Or contact us at 1-800-706-0318. If you want to be on our show, feel free to email or call. And if you have a topic, feel free to email or call as well.
Thanks for listening to Unpause Your Life. For show notes and more, head on over to unpauseyourlife.com.
Big shout out to recoveryinnovators.com for help producing this show. Thank you, guys.
I took a walk down the long road where they said that I shouldn't go. On my way found a reason to wake up another day. But they needed to show you all the things that you won't do. Find faith or religion, but nothing to show for it. No need to escape in love with my pain. I may be awake, but I'm alive, still alive, and I won't be bound by your mistake. No, I won't be your enemy, trapped at the gate. Bring me to life, put me to death. Just give me something that's just not so hard to believe. To believe. To believe. I took a walk down the dark road where they said that I shouldn't go. I knew the dangers of flying. Now I'm so far from silent cries.